Good afternoon, everyone. Welcome to my channel, Total Health Reform. And, I thought it would be nice to just join in this afternoon and continue to share my cancer journey. And I hope that it will be a blessing to someone that will be listening this afternoon. And I was looking back at my last video, and we stopped off where I was diagnosed, of course, with carcinoma of the right breast, getting that diagnosis and, going from there, um, dealing with the fact that I had to make a decision as to surgery and, getting a surgeon that I felt comfortable with. That's where I left off. So, um, I'll pick up from there. And so, I had to look for a surgeon, and, I found a wonderful surgeon, and we scheduled an appointment to go and see her and, sit down with her. And she pretty much would go over my records and my files, and, we would talk about what would be the best avenue for me to go. And so, upon meeting with her, I was very comfortable with her. And she reviewed my records. She wanted a little bit of um, my life story, history, because I think many times they associate cancer with stressors in our lives. And she wanted to kind of go a little deeper to really understand where I'm coming from and what I've had to deal with in my life, and how I got to this point, you know. And so we sat down. We spent about 2 hours talking, pretty much going back from my childhood and just sharing um, pretty much my life journey with her. And after going over my records, she said, she wanted to run a couple more tests, a couple more um, pretty much she wanted to do some biopsies because there were a few other areas, small little spot within the breast area that she was a little concerned about. They didn't know basically if those areas were cancerous or not. And so I think it was five of those areas within that same breast, along under the right breast and, you know, around the nipple area that she wanted to get tested. And once she got those results back, we would make a decision as to whether a mastectomy or a lumpectomy would be the right choice for me. And so I had those biopsies, very painful, because they were those tiny spots were in areas that was difficult to get to. And I remember going to those appointments, and you know I don't think the surgery was as painful as those biopsies. And there was one particular time when I had to be in a certain contraption in the radiologist's office where they did the biopsies, and they had to put dye in me, and they actually had to go deep within the breast to get to two of those areas. That was very, very painful. And I remember laying face down on the table and just tearing up because I felt like it was too much. It was too much. And I was thinking, why is God allowing me to go through this? It was just overwhelmed, right? Um, and when that was over and she got the results, she called me back to the office and she said, there are five areas. They're only able to get to two of the areas. And, either I can go back and have the other three checked, but the first two that they were able to check, there's nothing conclusive there that those areas were cancerous. And, you know, um, if that's the case, then the other three, maybe it's best to leave them alone. And I was like, yes, we're not going to go through that again. And so we talked about having the lumpectomy because the mastectomy um, would be, removing the whole breast. And she didn't see the necessity of that, which I didn't at the time either. And so she kind of just sat me down and kind of with a diagram showed me what a lumpectomy was all about. They would go in and they would remove that lump, and they would burn the areas around that tissue, you know, radiate, have radiation around that area before they close me back up. And then later on, we would discuss chemotherapy and radiation. And so that was laid out to me. And, at the time, I was open to the surgery. I didn't think much about it, about not having the surgery done, because all I could think was like, okay, if you cut out this lump, I'll be fine. Everything will be okay. I'll be back to normal. I'll be my old self. And, the cancer will be gone. That's what they tell us. Once they cut it out, it's gone. Or, as long as you get the radiation and the chemotherapy and, you do what the doctors say, you have a great chance of recovery. And so, I decided to have the surgery, the lumpectomy done. And so I that end of September, it was scheduled. I was scheduled for surgery, outpatient surgery, of course. And when I think back now, and you might be think I'm crazy, but when I think back now, if I knew what I know now, I would never had the surgery. And I believe that in my heart, I would never had the surgery. But I didn't start looking deep into things, reading up on cancer, reading up on radiation, reading up on chemotherapy, reading up on alternative treatment like I do now. And so my focus was just getting that thing out of me. And so the surgery was scheduled, and it was during, like I said, COVID time. I had to get COVID tested before surgery, and they did schedule an outpatient surgery. And I remember the morning I went in for surgery, I had to be there very early, and praying and asking God to give me the strength and help me to have faith and trust in Him that this is the right thing that I'm doing. Um, and I was prepped for surgery, and I remember my surgeon coming in and talking to me just before surgery, and I had this great desire to just hold her hand and pray with her. And I asked her, I said, can I pray with you? And she was like, sure. She kind of like was taken back by it. And I held her hand and I prayed with her. Didn't pray for myself, but I prayed for her that God will continue to bless her and to use her to be a blessing to others in her field of helping women that are in my same situation, and that God would guide her hands and all the other people that would be in there in my surgery, that He would, just kind of allow everything to um, go well. And, I was trusting God, still trusting, but during that time, my faith was totally involved in Him. And I prayed and I said, God, if I don't wake up after this, I hope that the next person face I will see is yours. And that's how I let go, and I let God. I went into surgery, and I remember, I think it was like 3 hours later, um, coming out of uh, the anesthesia, and them telling me that everything seems to have gone well. And, it will take a couple of weeks for healing to, healing of the area to um, come forth. And then after that, I would have to go see the oncologist. And so they gave me pain medication to go home with. And I remember going home and, you know, um, everything wearing off. And I did not have any pain, believe it or not. The medication they gave me, I did not need it. Um, and next day, I was up walking in my backyard. And during this time, or even prior to having the surgery, I started to focus on um, health, you know, following a total plant-based diet, um, learning how to cook for myself. I didn't know which direction, how to prepare my meals. I was pretty much lost, but I know this is the area that I wanted to go. I didn't want to go back to eating fish and cheese and eggs because even though I was a vegetarian, I did eat fish and I did sometimes have eggs and I did sometimes even, had items with milk products in there, and I did do sugar. I mean, all those things I didn't pay attention to prior to being diagnosed with cancer. And so once I was diagnosed, I started to take extra care in caring for myself and what I put into my body. And so, after the surgery, I had already started on a plant-based diet, but I started to be even more detailed in how um, I take care of myself physically, mentally, and spiritually. And so, for some reason, I started to think about um, gearing towards a alternative treatment. Prior to me having the surgery, I did think about getting radiation after the surgery. I did speak to the surgeon prior to that that I would, look into that if that was something that was recommended. And so after the surgery, I started to reading up on cancer, breast cancer, and um, the immune system. Um, if radiation was recommended, what would be the side effects? um, Same thing with the chemotherapy. And so I started to question things and started to uh, talk to God about what I should do, you know? And so I started to think about lifestyle centers. And I know in the Adventist faith, we have quite a few of our lifestyle centers that geared towards alternative treatment. And so I started to look into that and thinking about that direction, you know? And so by the time my 2 weeks came around to see the oncologist, I was pretty like almost set in going towards alternative treatment. And so I had already started to look at different lifestyle centers. Um, and this is something that I believe was spiritually laid on my heart. And so I went to my oncologist appointment after 2 weeks, and I remember going into the oncologist office, and I saw women. I saw women with their hair missing, you know, that had gone bald. And I'm wondering, Lord, is this what I'm gonna face? Um, and by the way, I don't know if I said this in my first video. My cancer was diagnosed at a stage 2, a little over a stage 2, closer to a stage 3, and it was a grade 1. It wasn't as aggressive because the grade is what tells you how aggressive the cancer is. And so I was like truly blessed by that. Not the fact that, it wasn't as aggressive, but the fact that it was a slow moving type cancer. It also was estrogen driven. That means um, it was treatable, right? With estrogen blockers. Um, and so I was told that was a good thing. And yet I didn't really comprehend what I'm dealing with. But back to, going to see the oncologist after the surgery and walking into that office for the first time and seeing women of all colors sitting around that office, some of them in their different stages of recovery. And it hit home that I'm here, I'm one of them, and sorry, I get a little emotional. And yeah, and seeing there was one lady, after I you know saw the receptionist and was waiting to see the oncologist. She came in, off the elevator with a handheld type pole with a machine attached to her breast. And I was like, wow, this is crazy. Is this something that I'm going to have to face? And, you know, um, I just didn't know how to deal with that at the time. How it kind of made me emotional, and also to the point that questioning, is there hope for any one of us in this situation? God, how do we rectify this? Where do we start? And so I went in to see my oncologist, and you know it's been 2 weeks now, and of course the incision had pretty much healed up really nice. I didn't have any swelling, no redness, just the scar, and the scar was pretty much healed. And I felt good, at the time. And so, she looked at my scar and she said, "Oh, you healed up pretty well." And I said, "Yes, praise be to God." And then she said to me, "Well, I want to see if you're a candidate for chemotherapy." And I looked at her and I said, "A candidate for chemotherapy?" And she said, "Yes." And I knew at the time I had already read up on chemo and what it did to the body in, as far as the bad cells and the good cells. And I had already made up my mind, it's not going to happen. I'm not going to do it. And so I said to her, I said, "Doc, I don't want to know if I'm a candidate for chemotherapy, because either way, I'm not going to do it." And she looked at me and she seemed to had changed that happy-go-lucky look on her face to this stern and angry look. And she said, "What are you talking about? Do you know that this thing can kill you?" And I said, "Doc, yeah." I said, "This thing can kill me, but I can also walk right out of your office here and get hit by a bus, and that can kill me too. So I can't worry about it killing me at the moment, you know, me not doing radiation, this thing killing me. I have to put trust in God. And right now, my faith is in Him." And she was like, "Okay, okay, if that's what you want to do, but let me tell you, you have to be very careful. It's very careful, because you will need, if you're not accepting the fact that you may be a candidate for chemotherapy, then you need to go and make sure that you get radiation and you get it quick and fast, right? Because um, there are you're not cancer free." And I said, "Okay, doc, I will keep the appointment with the radiologist, and I will go to the appointment." And she says, "And as far as the estrogen, I'm not writing you a prescription until you see the radiologist." And I said, "Okay." And she said, "Okay." She said, "Make your appointment. And after you go and see the radiologist, I'll schedule an appointment for you to come back and see me." I said, "Okay, thank you." And so I left her office, and, I felt very disappointed in her of the way she treated me at that point, because she got very angry with me because I refused to even find out if I was a candidate for chemotherapy, which I knew in my mind at that time it was done. It was closed. I would not consider chemotherapy. And I told the Lord that, that that is not what I will do. I will trust in you, Lord, because I know that you are the great physician, you're the great healer. And even after I had the surgery and I started to read up on things, I realized it having the surgery did not guarantee me that this lump would not come back. As a matter of fact, sometimes they multiply from my reading up, right? And so I decided that I will gear towards now a alternative treatment. And she said to me before I left her office, the oncologist, she said, if your surgeon knew that you would not have chemotherapy and radiation, she should never had done a lumpectomy on you. I said, okay, I'm sorry about that, but I've made a decision, and this is the direction and I'll be going. And so I left her office, and within a week later, I was scheduled to go and see the radiologist. By this time, of course, I'm reading up on radiation too. And Lord knows I've had a lot of uh, uh, x-rays and things in my lifetime. So who knows, how much radiation I may have gotten during my lifetime. But I scheduled the appointment and I went into her office. And of course, she was a very nice woman. At all wonderful doctors, even my oncologist. I respect her. I respect her decision on her recommendation for her patients. But sometimes like my regular physician says, we can recommend, but it's all up to the patient, and they respect that. And so I went to the radiologist, and of course, she tests, and she said, "Oh, again, you've healed up really well." And I said, "Praise God." And she says, "Well, you know, um, I said, Doc, can you share with me what radiation is all about? I mean, what will it accomplish with this surgery that I've had? I mean, how is it going to help me? And what are the side effects? I'm learning now to ask questions." And so she said to me, well, it's based on the size of your breast, how long you will have radiation. And I said, well, as for me, how long do you see? I'm thinking in my mind, if I decide, I haven't made a decision yet, but if I decide to do the radiation, it would be something maybe for a week or two. And she said to me, she said, based on this, the largeness of your breast, the smaller the breast is, the less radiation time we recommend. But the larger it is, then it could be from 4 to 6 weeks. And so after she checked me out, she says, "Well, I'm recommending 6 weeks of radiation." I said, 6 weeks of radiation? She said, "Yes." And I said, "Well, how many days per week?" She says, "You're going to be doing 5 days a week for 6 weeks." I said, "Doc, that's a lot." She said, "Yes." She said, "We need to get every area of your breast and kill all those cells." I'm thinking, yeah, you're going to kill my good cells and my bad cells. Right now, I'm sitting on your table. I feel good. I am healthy. Um, I don't know what's going on in my body, but I feel good right now. And I said, "What are the side effects?" She says, "Well, some people may notice a little bit of their hair falling out from because we give you a mega dose of radiation every time you come in. Um, because some women of color, their skin reacts different way to the radiation. So for us as women of color, you will find that some of the skin starting to thicken around the breasts and dry up. And so we give you cream, and sometimes the radiation is like it gives you a really bad sunburn, so it causes the skin to start peeling. But we give you this cream that you can rub on it and rub on it, and that will help you um, in healing the breast. And some women may feel tired, not recommend, but feel a little tiredness, after the radiation, after they leave Every day they may want to lay down. And some women have talked about having feeling a little nauseous and stuff. She said, but that's it. But once it's over, you'll be fine, and things like that. And I said, wow. And then I said, then she says, well, all we do, we mark the little area where we'll be putting that radiation. So you come in and we'll chip you, and then we'll do this, and then we'll, take it from there, and you'll be coming in 6 weeks, 5 days a week. And I said, okay, doc. I said, she said, we can chip you today. I said, no, I don't want you to chip me today. I said, let me go home and discuss this with my husband, and I will decide if this is something that I would like to do. She says, well, you have to get it done fast. You have to get it done fast because it's very important that we catch whatever is left there right away. And I said, okay. And in the meantime, before I went to see the radiologist, I had already started to look into lifestyle centers. Um, and so I told her I will get back to them within a couple of weeks. I'll be traveling. And once I get back, I will decide if this is something that I want to do. And so she was, saying, well, you need to get in touch with us right away because it's very important that you um, get this radiation started. And so I left there, and I made up my mind that day too that I'm not going to do radiation. I said, Lord, my life is in your hands, just like my life is in his hands right now. I say, everything about me, you know. You know my beginning, you know my end, according to your word. You know my uprising, and you know my lying down. There's nothing, God, that I can do to save this life that you already made a decision when my beginning and when my end is about, right? But all I have to do is be obedient. I have to be obedient to your will, your way, your laws. And I believe if I'm obedient, that you will bless me and you will heal me in your time. God ways, his ways are not ours, and his thoughts are not our thoughts, right? So I don't know when. Sometimes we pray for healing, we pray for other things in our lives, and God don't respond right away. Sometimes he allows us to go through the fire, right? Before he said, okay, it is enough. I look at the life of Job, you know, and Job had faith. And Job, he knew that he knew who his creator is. And he knew that God was in control of everything. Job even cursed the day that he was born. And so I left there knowing that I'm gonna put God in the at the wheel. He's gonna have to lead me. And I'm gonna have to trust him all the way. And so I got home and I spoke to my husband about the situation with the radiation and my kids, and everybody thought I was crazy. Not my husband, but the kids most likely. They said, Mom, you need to get the radiation. You need to get this done because, what if this or what if that? I said, well, what if? We have to trust God. And I'm going to trust God. And so I've decided to take a different route. I've decided to do alternative treatment. And so I've been looking at a lifestyle center or looking at different lifestyle centers. And I've decided this is the route that I want to go. I want to do an alternative way of treatment, right? And so there was a lifestyle center that I was looking at. There are quite a few, but there was one that I particularly focused on. And I believe that God led me to that particular lifestyle center, right? And so I called them up and I was looking into what the cost would be for me to go and spend a few weeks there, where they would teach me how to care for my body. At the time, I had a big knot in the breast, in the tissue area, and after the surgery, and so that was pretty much poking out, and I wanted to find out how or what I can do to kind of, release that stress in the tissue. And I also wanted to learn how to cook my own meals, total, total plant-based. I wanted to learn how to do the different poultice on my breasts and, all the other things that they could teach me. Not the fact that it's guaranteed that I'm going to be healed from all this, because I know that God is the ultimate healer and the ultimate physician. I know He's the one that will ultimately do the healing, but He has given us all these other things to test our faith. And so I found a lifestyle center, Adventist Lifestyle Center, by the name of Heartland, right? Heartland Lifestyle Center. And this lifestyle center is located in Virginia. And that was the place that God led me to. I called them up and they told me they had a program coming up within 3 weeks in October that I could attend. And as long as I was able to get the funds there in time, I can register for that particular program. And it's basically for cancer patients. They will teach us how to care for our bodies, how to cook, how to, different, totally different lifestyle, spiritually, mentally, and physically. And so I started praying. I started praying. And at the time, I was, we were financially strapped at the time. And I started praying and I said, God, if this is the place that you want me to go, you will provide the means. And that's where I put my faith totally in Him, totally. And one of my church sisters called me that, I think that particular day that I came home from the radiologist's office, and we were talking. And I said, I found this lifestyle center that I want to go to, but the fee for the registration is this much. And I have to get it in there by tomorrow. I says, I need you to pray that God will provide those means for me to be able to register for the lifestyle center. And then I'll worry about the rest later. And she said to me, she said, how much is the lifestyle? And I gave her the amount. And she said, well, don't worry. Don't worry. I will sell the money to you right now. And I'm like, what? God, you're on the move already? And sure enough, she, as after we talked and she prayed with me and we prayed together, she zelled that money that I needed for the registration to that particular lifestyle center, and I was able to send it off to them. And they sent me the paperwork. I registered for the lifestyle center for that particular program that was coming up within 3 weeks. And then I said to the Lord, I said, okay, God, the program is going to cost this much. It's close to 4,000. It's going to cost this much. I don't see where that's going to come from. But again, Lord, if this is what you want for me, then you're going to provide the means for me to go to this lifestyle center. And, my husband and I, we thought about maybe trying to get those funds in some areas where we had funds tied up, but we couldn't. It would have cost us a lot. So I was like, okay, God, you're the only one that can do this. And I'm telling you, I put faith in the Lord and I started praying. And I said, I need this much, God, by this time. And I know you're going to provide it if this is the route that you want me to go. And when my husband came home that night, I I told him, I said, honey, the program starts on such and such date. And guess what? I got my ticket to fly to Virginia. He said, you got your ticket to fly to Virginia? I said, yes. He said, but you have a 4,000 bill that you have to pay before you go to Virginia. Why would you buy a ticket when you don't have those funds? I say, I have those funds. He said, you do? I said, yes, God will provide it. I says, I'm walking by faith. And I said, I just bought my ticket for the date, and I know that I will be on that plane going to Virginia, and God will provide the means. Amen. And so God is so merciful. I remember the day before the funds was supposed to be turned in to the Lifestyle Center. It was like all those funds just started to pour in. Family and friends that I didn't even know I could depend on was there for me, right? And I remember I started to that the funds were Zelled to me, and I Zelled the money to the Lifestyle Center. And I remember they got the next day I was where I needed to be able to attend the program. And even after the date where I was supposed to have that initial amount into the program, I still had funds coming in, supporting me to be able to go to. It was like God opened the windows of heaven, and all the blessings, like He said in His word, kept falling down to the point where I had to tell people, I don't need any more. God's been truly, truly great, great in providing the means. And, He provided, I mean, everything that I needed. And I was able to fly to Virginia, to Heartland Lifestyle Center, and, attend their program. And I'm going to share that with you in my next video, how God worked in mysterious ways. Because when I got to Heartland Lifestyle Center, I was the only patient. I was the only patient. And I thought the program normally um, would entertain about maybe five, I think I was told 5 to 8 patients, for each session. I was the only patient. I thought it was kind of strange, but, I was happy. It was a beautiful place, just country setting, beautiful, fresh air. Just, and it was a little chilly, but nice. My room was beautiful. The food was like divine. And so the next day, um, and I'll stop here. I went down to have breakfast, and they said, "Oh, the director would like to meet with you." And I said, "Sure," and I met with her. And she said to me, "I wanted to meet you, Miss Brenda. We're so excited to have you." And she said, with COVID going on, we had a group of people to attend this program, but everybody, canceled out. You were the only one that did not cancel. And we thought about canceling the session, but I said, you know what? I cannot cancel the session because everybody pretty much fell out except for one. We have to keep the program going, even if it was for one person. Cancellation was not on my mind. And so they were excited. Even though I was at the time the only patient, they were willing to have the lifestyle doctor come all the way from uh, his little town to be there to teach. And all of them were ready to service me and do whatever is necessary for me to, graduate from the program. And I felt like a princess. I said, God, you're so awesome. You are so awesome. And so, you know, that's how my day began at Heartland Lifestyle Center. Beautiful people. Um, I will share in my next video my program, what I had to do, how I, endure those different treatments that was administered to me. God was really, really in the midst of everything. And so I just want to leave this message to say that that was only the beginning of the journey that God has taken me on. And even now, the journey sometimes become rough, right? but I have still never turned back from trusting the Lord. I still have not regret not having chemotherapy and radiation, even though sometimes the affliction seems to be too much. I still continue to hold on to God's great big hands. And my faith is and trust is in Him. And I know my life is in His hands. He created me, He knows everything about me, He knows every little thing that goes on in my body. And so I continue to trust in Him. And my prayer is that you continue to pray for me because I need all the prayers that I can get as I continue on this journey, trusting and believing that God is the ultimate healer and He can do for me. He created man. He gave man wisdom, knowledge, and understanding. And so for me, if He gives man wisdom, knowledge, and understanding, then I go to the source. And that's where I'm at on this journey right now. I'm still going to the source of my strength. So I hope this has been a blessing to you. And I hope to share a little more on this cancer journey with you as God opens those doors. Amen. Have a blessed day. Subscribe, share, and like my channel.